40 years. That's how long I spent inside one of the most advanced hospital systems in America, watching patients arrive by ambulance after a stroke had already taken something from them. Their speech, their movement, their independence, and thinking to myself, if only they had known 1 month earlier. My name is Dr. Raymond Chen. I'm a board-certified endocrinologist and metabolic health specialist based in Scottsdale, Arizona. And what I'm about to share with you in the next few minutes is not in any pamphlet your primary care doctor hands you. It's not on the poster in the waiting room. It is the conversation that happens between specialists, the one that almost never reaches you. Because here's the truth that haunts me. Stroke is not a sudden event. It is a slow announcement. And your body starts making that announcement up to 30 days before anything catastrophic happens. I know because my body made that announcement to me. At 58 years old, I was the doctor prescribing the medications, recommending the diets, running the labs, and I missed every single sign in myself. I ended up in a hospital bed with a pre-heart attack diagnosis and severe pre-diabetes, and I had to fly to Taipei, Taiwan, to recover my great-grandfather's handwritten herbal medicine journals, just to understand what my own Western training had completely overlooked. That the body speaks in whispers long before it screams. Today I want to make sure you can hear those whispers. 7 warning signs. 7 signals your body sends in the weeks before a stroke. And I promise you, at least 2 or 3 of these are things you have already experienced and dismissed as nothing. You told yourself it was stress. You told yourself it was age. You told yourself it would pass. And maybe it did. But if you're watching this, your body may be trying to tell you something right now that you cannot afford to ignore. Let's start with the one that almost no one talks about. The one I call the silent flicker. You're sitting quietly, maybe reading, maybe watching television, and suddenly your vision goes strange. Not painful, not dramatic. Just for a few seconds, things look slightly blurry, or you notice a shadow at the edge of what you see, or one eye seems to go dim for a moment, and then it's gone. And you think, I need new glasses, or I've been staring at screens too long. What's actually happening inside your brain is something called a transient ischemic attack, a TIA, or in some cases, a series of micro blockages in the small blood vessels that feed your visual cortex. Think of your brain's blood supply like a network of irrigation channels feeding a garden. When one of those channels gets temporarily blocked, even for 30 seconds, the part of the garden it feeds goes dry. Your vision flickers. Then the blockage shifts or dissolves and the water returns. The garden looks fine again, but the channel is still narrowed, and the next blockage may not be temporary. Research published in the journal Stroke found that people who experienced even one episode of sudden temporary vision change were 4 times more likely to suffer a major stroke within the following 90 days. 4 times. And most of them never mentioned it to a doctor because it went away on its own. If you have experienced this even once in the last 30 days, I want you to write that down. We are going to talk about what to do with this list at the end. The second sign is one I hear constantly in my practice, and it is almost universally dismissed. Unusual persistent fatigue. Not the tiredness you feel after a long day. I'm talking about a heaviness that settles into your body in the middle of the morning when you haven't done anything strenuous. A fatigue that coffee doesn't touch. A tiredness that makes you feel like your limbs are filled with something heavier than blood. Most people assume this is low iron, or poor sleep, or just getting older. But in my clinical experience, when a patient over 60 describes this specific quality of fatigue, sudden, unexplained, arriving in waves, it can indicate that the brain is struggling to regulate blood flow efficiently. Your brain consumes 20% of your body's total energy. When its circulation is compromised, when those delivery channels are narrowing, the brain begins rationing. And the first thing it cuts is your energy reserve. The Cleveland Clinic published findings showing that unexplained fatigue was reported by nearly 60% of stroke patients in the weeks leading up to their event. 60%. And almost none of them connected it to their brain. They thought they needed more sleep or better vitamins. Here's what I want you to do right now, specifically for this sign. For the next 7 days, write down the time of day when you feel that wave of unusual fatigue. Is it always mid-morning? Always after lunch? A pattern tells you something is cycling inside your body, And that pattern is data your doctor needs to see. The third sign is the one that genuinely frightens me the most when I see it in a patient, and it is the most commonly dismissed of all 7. Sudden, brief confusion or mental fog that comes and goes. You're in the middle of a sentence and you lose the word. Not a complicated word, a simple, everyday word you've used 10,000 times. Or you walk into a room and you cannot for the life of you remember why you're there. Or someone asks you a question and for a few seconds the answer just isn't there, and then it rushes back. And you laugh it off. You say, senior moment. But here's what's actually happening. Think of your brain's neural pathways like electrical wiring inside a house. When the blood supply to a specific region is temporarily interrupted, it's like a circuit breaker flickering. The lights go out for a second. The power comes back. You think the wiring is fine. But the circuit breaker is tripping because there is a real problem somewhere in the system. And the next time it trips, it may not reset. The American Stroke Association identifies sudden confusion or trouble speaking as one of the primary warning signs in their FAST acronym. And yet, the subtle, passing version of this sign, the kind that lasts only seconds and then disappears, is almost never brought to medical attention. A study from Johns Hopkins followed 1,800 adults over 60 and found that those who reported recurring episodes of brief word-finding difficulty had a significantly elevated stroke risk within the following 6 months. This is not a senior moment. This is your brain sending a distress signal, and you need to hear it. Now, right here, I want to pause for just a moment and ask you something directly. Of the 3 signs I've shared so far, the vision flicker, the unusual fatigue, the brief mental fog, have you experienced any of them in the last 30 days? Type yes in the comments right now if any of these sound familiar. I read every comment, and your answer may help someone else watching this realize they're not alone. Let's continue, because the next 4 signs are just as important, and one of them is something almost every person over 60 has experienced this week without knowing what it means. The 4th warning sign is tingling or numbness on one side of your body. Not both sides, one side. Maybe your left hand feels slightly numb when you wake up. Maybe the right side of your face feels faintly strange, like it fell asleep even though the rest of you is wide awake. Maybe one foot tingles persistently in a way that's different from the familiar foot fell asleep sensation. Most people assume this is a pinched nerve, poor circulation in that limb, or sleeping in a bad position, and sometimes it is. But when the numbness or tingling is one-sided and comes and goes without a clear mechanical cause, no pressure on the limb, no awkward sleeping position, it can indicate that the motor and sensory pathways on one side of your brain are being intermittently starved of blood. Your brain is divided. The left hemisphere controls the right side of your body. The right hemisphere controls the left. When blood flow is compromised in one hemisphere, the signals it sends to the body on the opposite side begin to distort, like a radio station losing its signal on one speaker while the other plays clearly. The music is still playing, but something is wrong with the transmission. The 5th sign is one that I find particularly insidious because it mimics something so common and so easily explained away. Sudden, severe headache with no obvious cause. Not a tension headache that builds slowly over the afternoon. A headache that arrives fast, sometimes described as the worst headache of your life, and then fades within an hour or 2. Neurologists have a name for this, a thunderclap headache. And it can be a sign that a small blood vessel in the brain has experienced a sudden pressure surge, what we call a hemorrhagic warning event. Think of a garden hose with a weak spot in the wall. When water pressure spikes, that weak spot bulges. It doesn't burst yet. The pressure normalizes. The hose looks fine. But that wall has been stressed, and the next pressure spike may be the one that breaks it. Research published in the New England Journal of Medicine found that patients who experienced at least one sudden severe headache in the 30 days before a major stroke were far more likely to have had that headache dismissed as a migraine or tension headache and sent home without imaging, without a brain scan, because it went away. If you have ever had a headache that arrived suddenly and intensely and then disappeared within a few hours, especially if you also experienced any other sign on this list at the same time, that is a medical conversation that needs to happen. Not next month, this week. The sixth sign is one of the most overlooked because it sounds like a balance or inner ear problem. Sudden dizziness or loss of balance that comes in brief episodes. You stand up and the room tilts slightly. You reach for something on a shelf and your body misjudges where your hand is. You feel briefly unsteady while walking and you grab a wall or a piece of furniture, and within a few seconds you're fine again. Most people attribute this to blood pressure changes when standing or inner ear crystals, a condition called BPPV, or simply dehydration. And yes, all of those can cause dizziness. But when dizziness arrives suddenly without a positional trigger, when it happens while you're already standing still, when it's accompanied by any other sign on this list, it can indicate that the cerebellum, the part of your brain responsible for balance and coordination, is receiving intermittent interruptions in its blood supply. The cerebellum sits at the base of your skull, and it is fed by some of the smallest, most vulnerable arteries in the entire cerebrovascular system. These arteries are the last in line, the farthest end of the delivery route. When blood pressure or blood viscosity changes, these small vessels are the first to suffer. And the cerebellum is the first to show you the result, a brief, unsettling loss of your spatial sense. A study in JAMA Internal Medicine followed over 2,000 adults with recurring unexplained dizziness and found that those with additional cardiovascular risk factors, elevated blood sugar, high blood pressure, elevated cholesterol, had a substantially elevated stroke risk within the following year, when their dizziness episodes were accompanied by even one other neurological symptom. Which brings me to the seventh sign, and this is the one I need you to sit with for a moment because it is the most personal, the most subtle, and the most universally dismissed of all seven. A sudden change in your emotional state that has no psychological explanation. I'm not talking about depression or anxiety that builds over weeks. I'm talking about sudden, inexplicable irritability that arrives out of nowhere and disappears just as fast. Or a wave of sadness that washes over you for no reason and lifts within minutes. Or a feeling of sudden, intense anxiety. Your heart rate rises, your breath shortens, and there's nothing in your environment that caused it. Your brain is not just a thinking machine, it is an emotional regulator. The limbic system, the region that processes emotion, is deeply integrated with your cardiovascular function. When blood flow to the prefrontal cortex and limbic regions is temporarily disrupted, the emotional regulation system becomes unstable. Emotions fire without triggers. Moods shift without cause. And because we live in a world that attributes emotional changes to stress, to sleep, to life circumstances, no one ever thinks to connect a sudden mood shift to their brain's blood supply. Let me tell you about a woman I'll call Frances. She was 72 years old, recently retired, living alone in Phoenix. Her daughter brought her in to see me because she said, "Mom has been acting strange for the past few weeks. She gets angry for no reason and then 5 minutes later she's completely back to normal. She gets these sudden crying spells. We thought it was grief." Frances herself was embarrassed to talk about it. She told me she felt like she was losing her mind. But when I asked her about the other signs, had she had any vision changes, any unusual fatigue, any headaches, her eyes went wide. She had experienced 4 of the 7 signs I've shared with you today in the same 30-day period, and she had attributed every single one of them to something else. We ordered imaging immediately. We found significant narrowing in 2 of the arteries feeding her right hemisphere. Frances had been 30 days away from a major stroke. Because her daughter noticed something was different and brought her in, we were able to intervene with medication, with dietary changes, with the kind of metabolic recalibration that my great-grandfather's journals first taught me to think about. And Frances did not have that stroke. She called me 3 months later. She said, "Dr. Chen, I thought you were going to tell me I was just getting old. Instead, you told me I could actually do something about it." And she cried. Not from sadness, from relief. That is exactly why I'm making this video, because Frances almost didn't come in. Because you might be sitting right now with 2 or 3 of these signs, telling yourself it's nothing, telling yourself it's just age. It is not just age. Your body is trying to tell you something, and now you know how to listen. So here is what I want you to do, starting today, not next week, today. First, take a piece of paper and write down every sign from this list that you have experienced in the last 30 days. Vision flickers, unusual fatigue, brief mental fog or word-finding difficulty, one-sided tingling or numbness, sudden severe headache that resolved quickly, unexplained dizziness or balance disruption, sudden unexplained emotional shifts. Write them down, all of them. Second, if you have experienced 2 or more of these signs, even once each, call your doctor this week and specifically use the words transient neurological symptoms. Those words will get you taken seriously. They will move you from a 3-month waitlist to an appointment this week. That is the language that signals urgency inside the medical system. Third, tonight before you go to sleep, do one simple thing. Lie on your back, place one hand on your chest, and take 5 slow, deliberate breaths. 4 counts in, hold for 4, 6 counts out. This is not a cure, but it is the beginning of what I call the dragon cycle, the practice of using timed breathing to regulate your autonomic nervous system and reduce the blood pressure spikes that stress those vulnerable cerebrovascular arteries. My great-grandfather wrote about this in 1932. The research behind it is now published in peer-reviewed cardiology journals, and it costs you nothing. Fourth, look in your kitchen cabinet right now. If you have cinnamon, turmeric, and ginger, 3 spices that appear in nearly every American pantry, you have the foundation of a metabolic support protocol that I have used with my patients for years to support healthy blood flow and reduce vascular inflammation. We'll go deep on exactly how to use these in an upcoming video, but for now, know that you already have what you need. Please, before you leave, share this video with someone you love. A spouse, a parent, a sibling, a friend who has mentioned any of these symptoms and laughed it off. You may be sending them something that saves their life. I am not exaggerating. I have seen it happen in my clinic. I have seen it happen in my own body. And if you found value in what I've shared today, subscribe to this channel. Because what I'm building here is the conversation that should have been happening between doctors and patients for decades. The information that gets filtered out, watered down, or buried under pharmaceutical recommendations before it ever reaches you. Type "I'm paying attention" in the comments right now if you're going to write down your symptoms today. I will read every single one, and I will know that this video did what it was supposed to do. I'm Dr. Raymond Chen, and I will see you in the next one, because there is still so much I need to tell you.